the things are on a change. We can see that change is the only thing constant, and it's become so very true now, wherein the speed of the change has also become faster. It's increasing, and this increased change is definitely going to affect the family and the social life. It's also going to affect the mental health and the physical health of the entire community. And when we look at the reproductive point of view, as we are seeing today, that about a decade back there was not so much of obesity in the womanhood. This obesity has a potential of going on to the rise. There have been certain predictors in the typical statistical analysis that we do for the population basis, that 2050 is going to be a big boom of obesity, diabetes, thyroid dysfunctions, and so many other problems in the community, and women are going to be at the heart of that all. If you really want to control this, now is the opportunity. And therefore what I am foreseeing is there's going to be rise in infertility, and not only amongst women, but it's also going to be amongst men. Just imagine if there's going to be too much of stress, there's going to be too much of obesity, too much of indulgence into vices such as drinking, smoking, there's too much of abnormal kind of lifestyles, then diurnal circadian rhythms are not up to the mark. We are heading towards a disruption in the society, and this disruption can affect the family life in a big way. Reproduction will take its own toll, and then there are going to be a whole lot of challenges like infertility, miscarriages, abnormalities in the sexual practices, abnormal mental physical health. And if we have to improvise this, we require to look at these things very, very seriously. Because just imagine if we have loads of children born who are going into a nursery or a neonatal ICU, who are premature, who are wanting, who are requiring assistance in their very early lives. What kind of a future community are we creating? It's our prime responsibility that while we are looking at the economical progress, while we are looking at the intelligentsia progress, while we are looking at modernization, are we ignoring what is essential at the basis of this entire change? And this is going to land us into turbulence, where there is going to be disruption in the family life, there will be no connect, and then we do not know where things are going to head. Likewise, there are advantages. There is so much of modernization now. There will be no dearth of information. Maybe it may cause more confusion, but all the same it will be there. There's going to be so much of research. There are going to be so many very well such kind of approaches wherein we can diagnose conditions, predict them much earlier, and then help in optimizing and bringing out better results. There are wonderful markers of simple condition like fetal growth restriction, where babies don't grow optimally inside the woman's uterus. This can be estimated or predicted much earlier in the pregnancy, and these kind of facilities, if they are approachable and available to us, where we can predict these conditions ahead of their occurrence, wherein there is a window of opportunity where we can modify them to bring about better results, is something that we also foresee. So every progress has both its sides. One is a negative aspect, which I mentioned at the outset, and the other is a positive aspect, that we will have access, and this access has to be brought about by correct structured information, which is based on strong foundation of knowledge and experience, and this will definitely help us deliver better babies. For example, a woman comes to you with a pregnancy, and if you do a proper checklisting at the first time itself, you are able to predict how much is going to be her challenge during the pregnancy, what modifications I can do. There are a whole lot of nutritional modifications, physical, mental modifications which I can do. I can counsel her, I can ensure that she is able to take this pregnancy further. Aren't we going to be able to deliver better babies? And not only that, those babies will be better programmed to create better offsprings in future. So this transgenerational influence that I am talking about can be negative, which can be on a larger side if we don't act well in time, but it can also be positive because of the availability of so much of research and so much of amenities to implement these actions.
Do you see couples, coming to you with a plan to get? I mean, now they are looking at it very, very seriously.
Yeah, we do have, yes.
Yeah. So, why do you think still things are not up to the mark? As you mentioned that, yeah, they come with a plan, but then there is no plan at your end which can be given to them, which they can follow.
See, whenever a patient is getting pregnant, now for example, recently as I mentioned, there are quite a few youngsters who are coming to us before they embark upon pregnancy. They want it to be all normal because they have always done so much of planning. They do their financial planning, they do their house planning, they do their career planning, and then they are also understanding that they require to do even family planning. Not family planning in the typical perspective of not having babies, but wanting to have babies in a normal kind of an environment. And to try to ask me whether it's the right time to get babies, or whether it's okay to delay having babies, are we really healthy, and such kind of awareness is lots currently in the community. And what is most important on their minds always is that they want it to be as normal, as natural as is possible. But sometimes there are challenges because again there is a lot of myths that are there around this, that because these myths come from lack of information once again, and they do want to once they embark on pregnancy, they want to come on time. What is very heartening to see is that most of the times women are accompanied by their husbands, which was not very common. Usually in the past the family used to come, but now the husband comes. He is participating in the mother's care. In fact, they are so very actively there, wanting to be with her around the time of delivery, wanting to be there to be actual fathers, where they want to change nappies, take care of the baby while the baby is nursing and all these kind of things. So all such kind of plan is already there. So we have sensitized the population. The youngsters are very well sensitized. Unfortunately, we are still not having the facilities or the tools to deliver what they are demanding, and this is essential. And then what gets delivered to them is usually a lot of medical jargon, a lot of anxiety, lot of identification. When they are put through all those tests, there is somehow a response at the end of the test that you have to get worried, the test is normal or abnormal. It's not so. Tests are not done to find faults. Tests are done to ensure that everything is normal. So it's always looking at the things in the right perspective which matters, and that helps in the very, very long way. Now, for example, when we are screening patients for Down syndrome, for example, it's a screening test. For that matter, screening for anemia, screening for hypothyroidism is just a screening test. So what does the screening test tell us? That everything is fine and we can go forth. But if everything is not fine, for example, if that test doesn't come up to the mark, there are ways in which it can be modified. There are ways where it can be taken into much intricate and deeper analysis to be able to deliver the best results. This anxiety connect, which has come up with testing, with medical care, has made many youngsters now having a lot of fear about doctors, about medical services, and they say we want to deliver at home, we don't want to go to a doctor, we'll go to some other pathy doctor, allopathy gives us lot of medicines. It's not so. So we have to understand, and these kind of feedbacks actually has helped me in trying to realize how I can better my services and my approach to people. Because finally, if you decide to deliver any kind of medical goods, if there is no patient sitting in front of you to take them, how are we going to improvise the health of this country? So we have to convert this entire delivery system in such a wonderful cover that it will not be, because finally pregnancy is a normal thing. It's a physiological extension. It's not a pathology. It's not associated with any pathology inside the body. It just makes the woman's body change because it has to undergo certain adaptations, and these are all in the purview of a very, very healthy limit. So that healthy limit has to be identified, it has to be affirmed, it has to be confirmed, and it has to be maintained. And that actually is the thing that is very, very important at this point in time, wherein we must be able to deliver what the youngsters or the future generations are asking from us. They are asking for normalization of this very wonderful physiological condition of delivery, because there are a lot of aspersions nowadays casted upon pain relief during labor, or even while doing cesarean sections during labor. And then sometimes there are a lot of doubts about too many sonographies being necessary. Then why do I need to take these medicines? All this information has to be presented rationally. One, because it will be properly accepted. The timelines of those proper tests will be performed, and if there are necessary interventions, they can be undertaken well in time to try to optimize things properly.